How do you do, Professor Goddard?
Yes.
Thank you for agreeing to another interview.
Well, thank you for interviewing me.
My first question is this. What makes you uniquely qualified to talk about the origin and treatment of COVID-19?
Well, I wouldn't say that I'm uniquely qualified. There are a lot of people like myself who could talk about it. In fact, most scientists, if they looked at the information on the internet, would be able to talk about it. Of course, I am the author of Pandemic, a book about the subject, so perhaps that is the reason that I'm happy to do so.
So why are these other scientists not speaking up?
Well, that is a mystery. There are a few of us who are speaking up about the problems, about the origin of the virus and the problems that will occur with vaccines and with treatment, etc., etc. But we are few and far between.
So the World Health Organization inquiry did not satisfy you?
The inquiry into the origins of the virus, no, absolutely did not satisfy me. It's hard to really think of it as an inquiry. And I'll tell you why. Because the guys were chosen by the Chinese. They included a person called Peter Daszak from EcoHealth Alliance. Now, Peter Daszak didn't point out his conflict of interests. He had been working on coronaviruses in Wuhan. He didn't tell people this, and he had masterminded a letter in the Lancet back in the spring of last year, in which they said that the virus was completely natural and did not come from a laboratory. And that was at a time when he'd done no studies to see whether it had come from the laboratory. And he has since then pointed out that he did that because he didn't want people to blame the virologists in Wuhan.
Quite political. Let's take you back to the beginning. Where do you think the wild virus came from?
We have to be very careful here because there will have been a wild virus originally in a bat, but it was not COVID-19. The virus that we know as COVID-19 should not be described as a wild virus because that immediately prejudges the situation. In fact, the evidence points to it having been made in one of the 3 virology laboratories in Wuhan. And what is the evidence? You would ask me, I suppose. But is that the next question?
It indeed is, yes.
Right. Okay, yes, I suppose I should have predicted that. Well, the thing about it is that early on they came out with papers saying this is a completely natural virus, nothing unnatural about it at all. Well, that is not the case. What is particularly unnatural about this virus is that it has something called the furin cleavage site at just precisely the right place for it to infect human beings. I've got a little diagram I made there myself. It's a simple diagram and it shows all around here the spike proteins, and the bit I've drawn in pink is the furin cleavage site. Do you see that?
I think I do.
Yeah, okay. And inside you have the RNA. This is the glycoprotein. This pink bit attaches to the receptor in the human being, and then this is cleaved so that the spike protein can break into the cell and the RNA can be pushed into the human cells.
Fascinating.
Yeah, and here is the fascinating, very fascinating thing, that none of the other coronaviruses have a furin cleavage site exactly like this. None of them. But a number of the other pathogens that affect human beings, such as the AIDS virus, the avian flu, the Ebola virus, they do. So, how did it get this furin cleavage site? Well, firstly, it didn't get it from another bat virus, because none of them have it. Secondly, this particular version of the virus can almost not infect bats at all. So how could it have come from a bat? Also, it's not found in the pangolin. So this is abnormal. Where was it found?
Just explain the pangolin. It's
The pangolin is a little animal that the Chinese, in their original myth they put out, saying that, oh, this was natural, it came from a bat virus to a pangolin. The pangolin was taken by human beings to the meat market and people ate it, and that's how they got the virus. No, this virus cannot be found in this form in a bat, cannot be found in this form in a pangolin, and there's no evidence that it started in the meat market. In fact, the first few people to have it were virologists who were working in the laboratories.
Okay. And the pangolin's a sort of armadillo type.
You're absolutely right. It is like an armadillo. It's an interesting animal which is endangered and is illegally eaten by the Chinese.
Could you explain the term gain of function?
Oh, right, you've heard of that. Gain of function studies. Yes. Well, gain of function studies are something that virologists have been doing for a couple of decades now. They take a virus and by manipulating it, sometimes in the presence of another virus or playing around with it by injecting it in and out of animals, it gains function. Now, to start with, they did that so that they could, say, for example, get a better yield of a vaccine. But from 2011, they started trying to prove that some viruses could become pathogens if you did gain of function studies. So you take a virus that at the moment can't infect human beings and you give it the functionality of a pathogen. You make another disease.
And who might have been funding that if it was taking place in Wuhan?
Ah, right. So the work in 2011 was done originally in the Netherlands, funded by the NIH of the United States, the National Institute of Health, and it was their infectious diseases and allergies section, headed by one Dr. Fauci, who has become very famous. Right, Dr. Fauci funded that. He took it when they were successful in doing this with an influenza virus that was not at all pathogenic to human beings, but they managed to show that they could make it so. He then took this, over to the United States, and they started doing it in laboratories all around the United States, showing that they could take viruses and make them pathogenic. Now, I think you'll begin to agree that this is a remarkably stupid idea. So did the Obama administration, because these viruses kept on escaping from the laboratories. So he put a moratorium on it. Well, our Dr. Fauci said it's a risk worth taking, and he gave the money to Peter Daszak. Now, Peter Daszak of the EcoHealth Alliance, of course, popped up on the World Health Organization survey, their investigation recently, without telling people, of course, that this was a complete conflict of interests. And he wrote the letter in the Lancet saying it was a normal virus, without telling people this was a complete conflict of interests. Right. So the money came from the Americans to the EcoHealth Alliance, run by Peter Daszak. He's their chief executive officer. He took it to Wuhan and gave it to Shi Zhengli. Now, Shi Zhengli, is known as the Batwoman of Wuhan, and she is the virologist who had collected over 100 different species of coronavirus from bats and was trying to show that they were pathogenic in human beings, although this was very difficult because they didn't seem to be.
Right.
And she's the one who started doing the work.
So to make another disease sounds like it's quite dangerous. It's all very striking information. But we could say this is a conspiracy theory. Perhaps.
Yes, that's exactly what people... When I explain this to people, they say, no, that's just a conspiracy theory. The idea it comes from the laboratory. And they have listened to the stuff that's been put out by Daszak, by Fauci, and by the Chinese, and by a whole load of virologists who are all doing this type of research. So even here in Bristol, recently, I received a request from the Bristol Alumni Society, the alumni, saying, would I like to donate to a biosafety level 3 laboratory they're thinking of creating so they can work on viruses. And the sort of work they'd be doing, of course, would be gain-of-function studies? And the answer is no, I would not like to. No, I would not.
So a conspiracy theory, and a cover-up. How are they all related?
Well, okay, to my mind, the likelihood is that this was a cock-up.
Cock-up, that's in there as well.
Yes, a cock-up. And so what they were doing was making these things, and yes, they would. I suspect that they were mostly doing it for benign purposes, and it got free. I say I suspect because there are other theories as well. So then comes the cover-up. And usually you will find that the most famous conspiracies are a cover-up of a cock-up. Let's give the example of Watergate. They go in there, they do a bit of a cock-up of looking at the rivals, and then Nixon and his team tried to do a cover-up. That is the conspiracy, the cover-up.
Fascinating. Thank you for that. You say that you've had difficulty, or others have had difficulty publishing their findings.
Well, I've written loads of letters to newspapers and other, to the BBC and to other. And do they cover this? The answer is no. My friend, Professor Angus Dalgleish in London, was one of the very first people to note that the spike protein that I referred to earlier was abnormal. He was working with Børge Sorensen, who is a biochemist in Norway. And they found that the charge on the spike protein was something they had never seen in a normal virus, right? And the only way it could have got like that was people manipulating it, right? When they tried to publish this, they received the replies, this is not of interest, this is not of public interest, it goes on like that, right? Eventually they changed the article they were writing, and they talked about making the perfect vaccine, right? But in it, they also described why the vaccine had to be different from most other vaccines, because of course it has this abnormal spike protein. So they said, to make the proper vaccine, the best vaccine would be, don't aim for the spike proteins, which of course easily undergo variation, right? Don't go for those. Go for the bits that are conserved. Well, why not go for the spike proteins? Because they are human-like. They've been made in the laboratory to actually fit human receptors. If you start making things to do that, you do risk having autoimmune reactions. But they were going to go for that. So did they make it? The answer is yes, they did. They got it to the animal stage, and then the money ran out, and the money was pumped into the vaccines that we know about.
Okay. Do you have evidence that any country or organisation was instrumental in influencing the journalists? And the journals, I should say.
Well, I think the answer is yes, because whenever, at certain times when we've put things on Facebook, YouTube, and when people have put things on Twitter, it's been censored. Now, how does that work? I don't think there are people sitting there censoring it. I think these are algorithms. And the Chinese are very good at getting their minions to sit down and complain constantly about things. And in the end, the algorithms pick up what they're complaining about. So that at one point on YouTube, if you put anything that in any way was against the Chinese, and if you called it the China virus or the Chinese virus, it was immediately censored. And so yes, the Chinese have been doing that. But the strange thing is that certainly some universities, they have been telling people don't talk about the origin of the virus. And Professor Dalgleish received a missive to that effect, and then went and complained, I think, to the Vice-Chancellor or somebody like that. And he was told, no, this is nonsense, I'll stop them from sending these around. But they had been sent round by some people. Now, why would they do that? Okay. There is a lot of money involved here.
So you were speaking about social media just a moment ago, about university departments. We mentioned journalists and journals. Surely this sort of censorship has prevented proper scientific debate over COVID-19. And isn't the role of science and scientists to put up a theory and to disprove it?
You've got it absolutely right. That is the philosophy of science, isn't it? You put up a theory and then you have other people put up the opposite, or you look at what the people say and you try to, by experimentation, prove it to be wrong. Right. In this case, it hasn't happened because of this censorship from which I say has been pushed because of money. A lot of big journals like Nature, for example, have got a lot of money coming in from China and have been proudly boasting about the number of papers they've been accepting from Chinese scientists. And so they don't want to rock the boat.
Are the serious media covering these events and theories more thoroughly in other countries? And if so, why?
Yes, it's been very, very hard to get anything sensible into the British newspapers. I think when it gets into the Guardian, I will feel that the job has been done.
Right.
But at the moment, newspapers like the Guardian are absolutely refusing to believe anything except for it being a natural virus, and they are saying that everything else is conspiracy theory and fake news.
Extraordinary.
Now, but that's not true all around the world. If you went to Australia, you would find the Australian media is very happy to talk about this. And also, if you go to America, you find that. So I've been looking on Australian sites, American sites, and I've been finding a lot of information and a lot of interviews that they've done. For example, the Australians have interviewed Peter Daszak and made him look like an utter fool. When he was asked, so when you went into the laboratories, did you actually go into the laboratories? He said, well, no, we didn't go to the laboratories. So did you go to the hospitals and talk to the doctors? Well, no, we didn't. Did you actually speak to any of the patients the ones who were initially? No, we weren't. Were you allowed to go to the? Well, actually, no. We just sat in our hotel and they told us what to write and we wrote it down.
Fascinating.
And that all came out in their interviews. And so, if anybody really wants to find some good interviews, they should look up the Australian media and their interviews of the various people that I've mentioned.
Thank you. The vaccine paper #1 in QRB Discovery, written by your friends, has recently been downloaded more than 216,000 times, having been initially ignored.
Well, initially they just didn't believe what they were saying, and it's clear that the climate of opinion is changing. People are beginning to understand, and I'm not by that meaning the journals themselves or the top people in the universities, whatever, but the knowledgeable people generally are beginning to realise that there is something wrong with the story that it was natural, right? And don't forget, if I was able to find this information fairly easily, so can everybody else, right? And the very first paper that started pointing out that the furin cleavage site had abnormal ionic nature and abnormal charge was the paper in QRB. And this is a very reputable journal. And so whilst they weren't able in that article to actually say this proves it was made in the laboratory because it wasn't going to get published, it goes so far towards hinting that people are finding this fascinating. And also, they do want to know how to make a good vaccine. So, Birger Sorensen, who was initially treated as a pariah and a fool, has now recently been made the guru in charge of the vaccine program in Norway.
Wow.
Yeah.
Why does the origin of the virus matter?
Because if they had, for several reasons, first, if you know that it's not a normal virus, you can't necessarily respond to it in the normal way. And you have to realise that different measures are important. And we've discovered that over the last year. But secondly, they were experimenting on over 100 coronaviruses. We know that. They've admitted this. And they've said they could easily make them infective for human beings. Right. So, how many more have they got in their fridges? Also, it's not just the virologists in Wuhan. We know America and Britain were involved because we know that Dr. Fauci provided the money. That's America. Well, Peter Daszak is a British citizen. And so America and Britain are involved. How many of the laboratories in the rest of the world, USA, America, France, all of these, everywhere you can think, how many of them are working on gain of function studies in which they're making another disease? It is a foolish idea. There are millions of viruses just in a gallon of seawater, right? If we start trying to say any one of these could be pathogenic to human beings, let's make them pathogenic to prove they can be. All we're doing is making more and more diseases which we as doctors cannot treat because it's completely new. Yep. It's stupid.
So what should be done about it?
Oh, they've got to ban these sort of studies. And they've got to stop trying to say we need a lab like this as well because we'll get the big funding. They've got to stop doing it. And they've got to stop sending round letters to their alumni and saying we need more funding for a new laboratory. They don't know what they're doing. They are not doctors. They don't realise what we have to put up with. All the doctors have had to put up with looking after patients always. It's always been a very dangerous thing for medical staff. They've always been at risk of infection. And the fourth doctor in this country to die, the fourth doctor to die from the COVID was a friend of mine.
You say that you're angry about the treatment given for COVID-19.
Well, what I'm angry about is that the chief medical officer came out and forbade doctors from using some of the drugs that had a jolly good chance of working, saying we have to do studies on them to prove that they work. And so a lot of patients were then destined to die because they couldn't get any treatment. Also, I'm very angry that the hospitals pushed all the sick people out into the nursing homes without testing them and without providing any proper medical backup. And that people died in the nursing homes. I'm also angry that certainly here in the West Country, the hospitals did not look after people who were really sick, who didn't have COVID. And we know that because the excess deaths in the community were mostly 90% plus were not due to COVID. They were due to patients not going to hospital. So we know that they weren't being treated. That makes you angry.
Absolutely. I'm aware of the possibility of inquiries at some stage in the future, and I hope that they do take place. On another related aspect, was the British government informed about the importance of vitamin D in the immune system, and what is the role of aspirin?
Oh, that's good questions. Vitamin D is a very important vitamin. In some ways, it's not a vitamin. It is actually a hormone. And everybody in Britain is suffering from a certain level of deficiency of vitamin D throughout the winter months. Some younger people with skin that's exposed to the sun in the summer months will not be suffering from vitamin deficiency. Nearly everybody else is. Surveys have shown that 40 to 50% of the adults have chronic vitamin D deficiency. Now, most people think this is only affecting the bones. When I say only, it's a terrible thing when it affects the bones because they'll crumble and people will get what is known as osteomalacia, which is adult rickets. But it doesn't just affect the bones. It is a very important hormone for the immune system. It helps control the immune system. So, yes, they were told early on, and it was in my book, for example, and they were told by personal communications by people like Professor Dalgleish, and there was a group of doctors who were aware of this, and they were telling the government. including Parag Singhal from Western-super-Mare, who I must say is a wonderful chap, who, with other people, they sent round vitamin D to doctors all over the place saying, look, for goodness sake, if you can't get anybody else on it, get yourself on it. And the number of doctors dying stopped almost immediately. I mean, it reduced phenomenally because of that. And this is the reason that originally a lot of the people dying were from ethnic backgrounds which give them a dark skin. Because the darker the skin, the less likelihood there is that you'll have the right levels of vitamin D.
Fascinating. Did you mention aspirin?
Well, yes, of course. I forgot to say aspirin is important because the COVID-19, it gets into the bloodstream and it sticks to the actual blood vessels, and it causes clotting and it causes problems like that. Well, aspirin is good for preventing that. And aspirin is also anti-inflammatory, and the inflammatory response is the thing that eventually kills people with COVID-19. So aspirin is important. There are other drugs like ivermectin and a variety of monoclonal antibodies and things which also are what I would call repurposed drugs. All of these were more or less forbidden by the chief medical officer to start with.
Wow. But dexamethasone story, that was a success, wasn't it?
They came out and they proved that dexamethasone worked, and that's very good that it worked. It's a pity that they didn't take any notice of our rapid response letter in the BMJ, which actually said that repurposed drugs such as anti-inflammatories should be permitted. We didn't see any difficulty here in people who are not going to be put on a trial being given drugs. Yes, certainly people who are being put on a trial, they may, if they've given consent and they agree to go on a trial, they may have some drugs kept from them. But that's up to them. That's up to the people. That's not up to the chief medical officer. That it wasn't his role. And the doctors in this country should not really have listened to him, and they should have got on and doing it what they should have done under the GMC. The GMC says you've got to treat patients up to the highest level of your ability with the resources. These resources were there, so they should have been treating them.
So just to clarify, the doctors in this country should have ignored the chief medical officer.
Yes, that's my opinion.
And should have followed what takes place with the British Medical Council, the guidelines.
General Medical
Council, sorry. And the other thing that you mentioned earlier was the BMJ, what was it? You mentioned a journal, just with the acronym for it. I forget what it was. Is British Medical Journal, was that it?
No, I can't remember. But I'll tell you what I will say is that in Spain, they went straight on and gave them dexamethasone and other corticosteroids, and they had jolly good results. What it actually means is that several thousand people died in Britain who shouldn't have died. Probably the chap who actually announced the results said if they'd been giving this from the beginning, they would have saved 4,000 lives. So at least 4,000 people died who should not have done. And if they'd listened to the sort of things we were telling them in our rapid response, then they wouldn't have died. The patients wouldn't have died. Now, that again makes me angry. Doctors have been wasting their time writing letters, writing things about this, and yet quite often people like myself are classed as being not team players because we disagree with this sort of attitude.
Understood. I mean, it's been a little while since our first interview. A lot has been evolving. It's a dynamic situation. What do you believe the next steps should be?
Well, I certainly believe that we should open up completely now, that we should, that people should admit, the politicians should admit that their lockdowns did a lot of harm and very little good. If you compare the lockdowns here with the non-lockdown in Sweden, we've had exactly the same number of deaths proportionately. And people are actually looking at places like Brazil, where they're getting a lot of deaths, and they're saying this is because they didn't lock down. No, that isn't the case. It's because they haven't vaccinated the people quickly enough. And actually, at the moment, they haven't had quite as many deaths proportionately in Brazil as we have had in Britain. So locking down didn't save us. What saved people certainly was their own self-isolation. If a person has a high level of risk because they're immunosuppressed, then they should continue to self-isolate until they're totally vaccinated or until the risk has diminished to such a level that they're very unlikely to be infected. At this point, I will point out that now that this virus exists, it is never going to go away. Mm-hmm. It will continue to rumble along, and there'll be occasional people appearing with it. But it's never going to go away.
When you mentioned lockdown and self-isolation, it can be easy for the general public to become confused. Lockdown is talking about social life, business life, and self-isolation is about the way that you conduct yourself and your household. And so some people think of lockdown as including self-isolation. You're making a separation between the two.
Oh, yes, absolutely. Lockdown is telling people you're not allowed to go to work, you're not allowed to go to the cinema, you're not allowed to do this. Oh, that's lockdown, right? People get confused between quarantine, lockdown, self-isolation, and a whole load of other things like that. Now, self-isolation, the person should take themselves out of society because either they think they've got the virus or they're very worried about getting it. That's up to them. That's a personal thing. Lockdowns have all been brought in by law, right? And they have ruined the economy. They've destroyed people's lives. They've kept people off school. And all of these things have had amazing detrimental effects.
But forgive me for interrupting. Isn't there the belief that individuals won't self-isolate or socially distance when they need to, so a lockdown needs to be imposed?
That's the suggestion, and the figures show quite the opposite. When they were told to self-isolate, immediately the virus started to wane. Now, how do we know that? That is because we can look at things like the death rates, and the deaths don't appear immediately. If you catch COVID, you don't die the same day. In fact, you're not likely to die for somewhere between 15 to 30 days. And when you actually look at the first lockdown, it started after the peak had passed. If you take that into account, if you take the lag period into account. So it never was necessary.
Except that lockdown was to encourage young people, for instance, who feel that they're invulnerable, and statistics show that they don't get COVID as much as older people, from socialising, partying, going to clubs, bringing COVID home to infect granny.
Well, so of course it made them totally miserable, and they weren't able to work, they weren't able to go to study, they weren't able to go to university, and if what I say had been done, which is for the person who is the vulnerable person to actually look after themselves and self-isolate, they would have been better off. Also, all of these lockdowns in the form of what I would call this amazing overreaction, which is dictatorial, has prevented people from having people sitting next to them when they're dying. It's prevented people from having funeral things. Now, this is not to say that I agree that people should go to great big spreading events. The super spreading events undoubtedly spread the virus. And the way that they're checking people now and they're doing the sort of opening up which they've done in Liverpool recently and at several, I think will show that at the moment there is very, very little danger from these events when the virus in the community is so low. Having said that, I think it is vital that people get themselves vaccinated, and I'm particularly talking about people who are over 50, because still in areas where the virus is prevalent, the risk of dying from the virus is greater than the risk of dying from the vaccines. I wish they'd taken note of my friend Professor Dalglish and Birgit Sorensen and had gone for the vaccine which was less likely to cause immune reactions. And I'm pleased that they're now pushing the Pfizer rather than the AstraZeneca, because the AstraZeneca certainly does have a higher risk, about a risk of 1 in 500,000 of dying from an abnormal blood clot. If you'd like me to put that risk in proportion, that's about the same risk as driving 500 miles.
Just to make sure that I've got this clear before we move on, it's a complex subject. We now have a lot of vaccination in the
Yes.
UK. You're advocating, with the high incidence of vaccination, lockdown is not necessary.
That's right.
It's too damaging for the economy. The benefits, for what they may be, are not worth the negatives of it. Was it not a reasonable response based upon lack of evidence to go for lockdown initially? Do you think it was completely and utterly misinformed and that it was a
I
mistake
think
from
they
the
were
beginning?
totally misinformed. It was a mistake from the beginning. The deaths were never going to be as high as they were told.
Okay.
And they keep on predicting the ridiculous levels of deaths, which never occurred.
So what about saving the NHS?
Well, you see,
Protecting the NHS, I mean.
there
to
were
say,
two
that's
things
two
they said
different
they were
things.
doing, right? Number one was protecting the NHS, and the other was protecting the vulnerable. Right, they weren't protecting the NHS, they were protecting the NHS management, right? Because they didn't want to fall flat on their face and be shown to not succeed in managing to look after people.
Okay.
Right. Secondly, they did not protect the vulnerable. They stuffed them into nursing homes where they got no treatment and they died. In fact, they did the exact opposite from protecting the vulnerable. So I think that the idea of protecting the NHS actually sticks in my craw. You know that wasn't what they were doing when they decided that we'll give them a rise. Right? Now,
Excuse me.
yes, exactly. For the last 10 years, the doctors have had no rise, right? Oh, of course, the chief executives and the managers, they've had enormous rise in their wages, but not the doctors. So what did they decide they'd give them? 1%.
Well,
Let me just point out.
I think this is such a big area. I would love to have another interview, a third interview with you, just to talk exclusively about the NHS.
NHS, the management, I think at some stage we'll do that. The
Okay.
test and trace, the comparison of the cost of test and trace with actually £37 billion on test and trace, which has failed, compared with £47 billion on the entire wages of the NHS for a year.
As I say, I think it's a fantastic subject. We've got to
Unbelievable.
cover at some stage, as well as the contracts that have been passed without proper due process. So that's another one. But let's just move on to an equally contentious, something that you and I have discussed before. You've argued that people of dark skin have not suffered from COVID-19 due to prejudice, but due to physiological reasons. Now, could it be said that that's a racist viewpoint?
Well, people do undoubtedly suffer due to prejudice, but it's not the COVID that makes them suffer, and it's not the reaction to say, the people have got, they're giving extra COVID, they're dying more from COVID because of prejudice. No, that isn't the case. The reason they're dying from the COVID is a physiological change in their bodies, which part of it could be due to prejudice. But that's the thing that's got to be treated. You cannot do anything instantly about prejudice. But what you can do something about immediately are things like low vitamin D. And you can treat people with vitamin D3. And the important thing there is to have the right level. The government came out eventually after being pushed, and Hancock stood there and said, well, it probably is a good idea if people do take vitamin D. And then the dosage, they said, was the right level for looking after bones. Right? We want to look after the immune system, and you need a lot more to do that. So we're saying that in the winter, you've got to use 2,000 international units per day. Right? Whereas they would say something like 400 international units. We're saying 2,000 international. And in the summer, if you're getting out in the sun, you could reduce that down to 1,000 international units. Otherwise, you're not going to get people up to the right levels of vitamin D in the bloodstream, and they won't have the right responses in their immune system.
Yeah.
Now, so are there any other things that are affecting people who are of what they say the minority ethnic groups? Well, yes, but they're all specific for that minority ethnic groups, and they shouldn't really be bundled together as one thing. Because if you bundle everything together and call them BAME, well, then you don't realise what it is that individually are problems. For example, people from Africa, a lot of them have sickle cell trait, and some of them have actual sickle cell disease. People from Italy, a lot of those have thalassemia. Now, these conditions are what we call comorbidities with other conditions, so that if you suffer from the virus, from COVID-19, and you have sickle cell trait, when you start to have anoxia, and the anoxia is very silent with COVID, when you start to have the anoxia...
That's low oxygen levels.
Low oxygen levels. When you start to have the low oxygen levels, you can be very severely affected, and your cells can start sickling. The red blood cells will sickle, and they'll change shape from the shape they should be, and they change to a sickle cell shape. And when they get to this shape, they then cause clotting, and they cause organ failure all around the body and complete collapse. So a person can go from looking perfectly fine, within minutes, they can go into total organ failure and near death.
Extraordinary.
Now, and that's true for thalassemia and for sickle cell. And these are things which particular groups of people suffer from. So clubbing them all together and saying this is all due to prejudice is not true. And add to that is the fact that a lot of the people who died from this initially were people treating, wonderful people who went back, having been retired, went back to work for the NHS, and they were treating they were treating people with COVID. And of the first 50 who died, 49 out of the first 50 were people who had dark skin.
Extraordinary.
And this is, and don't forget, they had high esteem in the public's eye. They were not prejudiced against. They had been on good wages. So they're not people who are poor. They're not people. So
And they're medical professionals.
And they're medical professionals.
Could that vulnerability have been predicted or foreseen?
Yes.
That's something else to follow up later. You earlier spoke about the AstraZeneca, and you mentioned other vaccines. The concern that you have for autoimmune reactions in some of the current vaccines, do you still hold that view very strongly? And
yes,
what's the
I do.
alternative?
I think what we have to say is that we're very pleased that the vaccines have been successful. I mean, I'm delighted that I've had the AstraZeneca. I've had both injections of AstraZeneca. I would say that the reactions that I got from it, which was a tiredness, aching muscles and such, is a very common reaction. And it lasted perhaps, each time it lasted for about a week to 10 days. That's a very common reaction. When you look at the form, it says that that's an uncommon reaction. It isn't. It's a common reaction. There's a form which they give out to you, which says on it what the reactions are. From the people I've spoken to, nearly everybody suffered from aching muscle strain. They didn't suffer the same way with the Pfizer. I have come across people who've suffered from reactions with the Pfizer, but in comparison, they're less common.
And the Pfizer.
But the reaction overall, the vaccines have been a great success, and we've got to be really grateful to all the people who volunteered to help.
Absolutely.
They've been an enormous number of people who've volunteered to help, and they've worked so very hard, and it's been a great success, and it has cut the pandemic dead in this country.
Professor Goddard, there's so many more questions to ask you.
There always are.
I think we've run out of time. That's an invitation to a third interview.
Well, there will be a third interview, and thank you very much for inviting me to.
Thank you so much for your time for this interview.
Well, it's been a pleasure.
Greatly appreciated.